Welcome, everyone. Get ready for a deep dive into oral health. We've got some seriously cool insights coming your way, straight from a medical textbook, the kind nurses and other healthcare pros use. We're talking anatomy, common complaints that, practically everyone sees, and how you as nurses can be like the ultimate oral health detectives.
It is amazing how much the mouth can actually reveal about a person's overall health.
Right.
It's like a secret code.
Oh, yeah.
And you're learning the language to decipher it.
I love that. Okay, so let's start our journey, right, through the oral landscape.
Yeah.
Imagine like peering into a patient's mouth. What are some of the first things you notice, besides maybe they need to floss a bit more?
Well, right off the bat, the color of the gingiva or gums can tell you a lot. You'll see variations depending on skin tone, of course, but any unusual changes, like a black line, it could hint at something like lead poisoning. And if they're looking a bit pale, anemia might be a concern.
So we're already picking up on those clues. What about the tongue? It seems like such a simple organ, but there's probably more to it than meets the eye, right?
Absolutely. The tongue is actually quite complex. There's tiny bumps you feel on the surface.
Yeah.
Those are called dorsal papillae, and they help with taste and texture perception. And while a thin white coating is normal, you'll want to pay attention to any significant changes in color or texture.
Okay.
Could signal an underlying issue.
You mentioned the gingiva and the tongue. What about the teeth?
The teeth are like little puzzle pieces.
Oh, yeah.
Each with its own job to do. And as nurses, you'll want to pay attention to their condition. Are any missing or discolored? Are they straight? Or are there any that seem kind of out of place?
Right.
These observations can provide valuable clues about a patient's overall health and hygiene habits.
It's not just about counting them to make sure we've got all 32.
Right, exactly.
And speaking of important landmarks, let's move further back to the pharynx.
Okay.
What should we be looking for there?
When a patient says, it's showtime,
Right.
That's your chance to get a clear view of the soft palate, that little teardrop-shaped uvula, and the tonsils nestled between the pillars. Remember, symmetry is key. If that uvula seems to be leaning to one side, it could be a sign of a cranial nerve problem, specifically with cranial nerve X, the vagus nerve.
Ooh, that sounds serious.
Yeah.
It's amazing how even like a slight asymmetry can hint at a bigger issue.
Absolutely.
Okay, so we've got the lips, the gingiva, the tongue, the teeth, and the pharynx. That covers the main players, right?
Pretty much. But don't forget about those hidden structures like the parotid duct openings.
Oh, right.
Near the upper second molars. Those tiny ducts deliver saliva from the parotid gland, and they can sometimes be involved in infections or blockages.
So even those seemingly insignificant details matter. It's like we're piecing together a puzzle.
Exact.
Every little piece counts. But let's be honest. Sometimes patients come in with complaints that seem pretty straightforward. Sore throat, bleeding gums, hoarseness, bad breath. How do we know when it's something simple versus something that needs further investigation?
That's where your detective skills really come in. Let's take a sore throat, for example. While most sore throats are just a sign of a common cold, you'll want to consider other possibilities. What if the sore throat is accompanied by a sore tongue?
Oh.
That could indicate a fungal infection, like oral candidiasis, thrush.
Okay.
Or even point to a systemic illness.
So even with those, like seemingly common complaints, we need to be thinking bigger picture.
Yeah, you always have to.
What about bleeding gums?
Bleeding gums, especially during brushing, are often a sign of gingivitis, which is inflammation of the gums. But it's crucial to ask about other bleeding tendencies or bruising elsewhere. It could be a clue to a more systemic issue.
And hoarseness. I mean, we've all lost our voices after a night of karaoke, but when should we be concerned?
Good question. If hoarseness persists for more than 2 weeks, it definitely warrants further investigation. It could be something as simple as acid reflux or vocal cord nodules, but it could also signal hypothyroidism or even head and neck cancers. Taking a thorough history, considering things like smoking, alcohol use, and environmental irritants is essential.
Wow, so even those like everyday complaints can be red flags.
Absolutely.
Okay, let's talk about the dreaded bad breath, or halitosis. Everyone experiences it sometimes, especially first thing in the morning, right?
Right. We all have a bit of malodor upon waking due to decreased saliva production during sleep. But persistent bad breath can be a sign of poor oral hygiene, or it could point to systemic diseases like diabetes, liver cirrhosis, or even respiratory issues like sinusitis.
It's amazing how interconnected oral health is with the rest of the body.
It really is.
So we've explored the anatomy, we've talked about those everyday complaints. What about the actual examination? What are some key things nurses should be looking for when examining a patient's mouth and pharynx?
The visual examination is like your detective's toolkit.
Okay.
Always remember to ask patients to remove any dentures to get a clear view of the underlying mucosa. And when you see a suspicious lesion, don't hesitate to palpate it. Checking for thickening or infiltration can help differentiate a benign condition from something more concerning, like malignancy.
Okay, so let's put on our detective hats and walk through a step-by-step examination. Where do we begin?
The lips are a great place to start. Examine their color, moisture, and look for any lumps, ulcers, cracks, or scaling. Don't forget to check for central cyanosis, which could indicate a heart or lung issue, or pallor, which might suggest anemia.
Got it. So lips first, checking for those subtle clues. What's next on our detective's checklist?
Next, grab your tongue blade and a good light source because we're heading into the oral mucosa. Look for any discolorations, ulcers, white patches, or nodules. Some findings might be completely benign, like a wavy white line where the teeth meet, which is often caused by chewing or sucking habits, but others could warrant further investigation.
It's like searching for hidden treasures. Some valuable, some not so much.
Exactly.
Okay, so after the oral mucosa, what's next?
Next up, the gingiva. We've already talked about color, but you'll also want to check for swelling and ulceration of the gum margins and those pointy interdental papillae. Swollen papillae are a classic sign of gingivitis, remember?
Right, so swollen gums, bad news. What about the teeth themselves?
When examining the teeth, pay close attention to any that are missing, discolored, misshapen, or abnormally positioned. Don't be afraid to gently palpate the teeth and gums to assess for looseness or tenderness.
Okay, teeth checked. What about the roof of the mouth?
The roof of the mouth, also known as the hard palate, should be inspected for any redness, discoloration, nodules, ulcers, or deformities. You might come across something called torus palatinus, which is a harmless bony growth that can look alarming, but is totally benign.
Good to know. So if it looks like a scary bony growth on the roof of the mouth, don't panic.
Exactly.
It's probably just torus palatinus. What about the floor of the mouth?
The floor of the mouth is another important area. Inspect it for any unusual whiteness or redness, nodules, or ulcers. And while you're down there, it's a good time to test the hypoglossal nerve, cranial nerve 12. Have the patient stick out their tongue. It should protrude symmetrically. Any deviation to one side could indicate a lesion on the nerve.
Okay, that makes sense. Floor of the mouth checked, hypoglossal nerve tested. What's left?
We've arrived at the tongue. Remember, it's important to inspect not just the top, but also the sides and undersurface, as those are common areas for cancer to develop. Men over 50, smokers, and those who use chewing tobacco or alcohol heavily are at increased risk, so be extra vigilant in those patients.
And what should we be looking for specifically?
Any persistent nodule or ulcer on the tongue, whether red or white, should be taken seriously, especially if it feels hard. Red lesions, known as erythroplakia, and white lesions, called leukoplakia, should always be biopsied to rule out malignancy.
Yikes. Okay, definitely taking notes on that one. How do we get a good look at the sides of the tongue?
Use a piece of gauze to gently pull the tongue to one side while you palpate with your gloved hand, feeling for any hardening.
So we're essentially giving the tongue a little workout while we're at it.
Exactly. And finally, we reach the pharynx. Have the patient say, ah, or yawn to get a good view. This is another opportunity to test a cranial nerve. This time it's the vagus nerve, cranial nerve X. The soft palate should rise symmetrically. If it doesn't, and the uvula deviates to one side, it could signal a problem with this cranial nerve.
Wow, so many opportunities to check those cranial nerves.
Yeah.
Okay, so we've got the patient saying, ah. What are we looking at specifically in the pharynx?
Inspect the soft palate, those anterior and posterior pillars, the uvula, the tonsils, and the pharynx itself. Look for any differences in color or symmetry, as well as any exudate, swelling, ulcers, or enlarged tonsils. Asymmetry in the tonsils, especially when accompanied by other symptoms, can sometimes be a red flag for more serious conditions like lymphoma.
Okay, so we've covered a lot of ground here. We've explored the anatomy, talked about common complaints, and even walked through a step-by-step examination. Where do we go from here?
Now that you've got your detective's toolkit ready, let's dive into some specific conditions that can pop up in the mouth and throat. There's a whole world of fascinating findings waiting to be discovered.
That sounds intriguing. Lead the way. All right, detective hat's still on. I'm ready to learn about some of those fascinating conditions you mentioned. What's first on our list?
Let's start with the lips. Have you ever heard of angular cheilitis?
It rings a bell, but I could use a refresher.
It often starts with softening of the skin at the corners of the mouth, followed by cracks or fissures.
Right.
It can be caused by nutritional deficiencies or more commonly by overclosure of the mouth, often seen in people without teeth or with ill-fitting dentures, saliva trapped in those fissures can lead to secondary infections, often with candida.
Ah, that's right. I remember learning about that. What about those scaly patches you sometimes see on the lower lip, especially in people who spend a lot of time in the sun? What are those all about?
That's actinic cheilitis, a precancerous condition caused primarily by excessive sun exposure. Fair-skinned men who work outdoors are particularly susceptible.
Oh, wow.
The lip loses its normal redness and can become scaly, thickened, and slightly averted. It's crucial to examine these lesions carefully because they can progress to squamous cell carcinoma of the lip.
So sun protection isn't just for the skin. We've got to protect those lips, too. And of course, we can't forget about cold sores, those painful blisters caused by the herpes simplex virus.
Exactly. You'll typically see a small cluster of vesicles that eventually break and form yellowish-brown crusts. While they usually heal within a couple of weeks, they can recur, especially during times of stress or illness.
Okay, we've covered a few lip conditions. What about the pharynx? We talked about the anatomy earlier, but what are some specific conditions that might pop up there?
Tonsillitis is a common one, especially in children. You'll often see those classic white or yellowish patches of exudate on the tonsils, often accompanied by a beefy red uvula. Fever and enlarged cervical lymph nodes are also common.
Right.
Often points to a bacterial infection like strep throat or possibly infectious mononucleosis, mono.
So those white patches on the tonsils are a pretty good indicator of an infection.
They can be, especially when combined with other symptoms. But remember, tonsils can be quite large even when they're not infected, especially in children. They might protrude beyond the pillars and even touch in the middle, but their color should still be a healthy pink.
Got it. It's all about putting those clues together. Are there any other, interesting conditions we should be aware of in the pharynx?
Well, diphtheria is one that's much less common now thanks to vaccinations, but it's still important to be aware because it can be life-threatening if not diagnosed and treated promptly.
Diphtheria, that's the one with the grayish membrane, right?
Exactly. The throat will typically be dull red and you'll see a grayish membrane called a pseudomembrane covering the uvula, pharynx, and even the tongue.
Oh, wow.
This membrane can actually obstruct the airway, so it's a serious condition that requires immediate medical attention.
Okay. Definitely adding diphtheria to my mental list of things to watch out for. Now, what about those tables in the textbook? They seem to be packed with even more information about specific findings.
Right.
In the lips, pharynx, gums, and even under the tongue.
Those tables are like little cheat sheets for nurses. They provide a visual guide to a wide range of conditions, making it easier to recognize them in practice.
Okay, let's do a quick rundown of some highlights. For instance, in the table about the lips, there's a condition called angioedema. What exactly is that?
Angioedema is essentially swelling beneath the skin or mucous membranes. It's caused by fluid leaking from blood vessels into the surrounding tissues. Think of it like your lips suddenly puffing up like balloons.
Oh.
It can be triggered by allergies, certain medications like NSAIDs, or even by a genetic predisposition.
Wow, that sounds pretty dramatic. Okay, angioedema noted. What about those little yellow spots you sometimes see inside the cheeks?
Yeah.
I think I've even noticed them in my own mouth.
Those are Fordyce spots, or Fordyce granules. They're totally normal sebaceous glands that just happen to be visible in the oral mucosa. They're usually not numerous and have no clinical significance, so no need to worry if you spot them.
Good to know. I'll stop obsessing over those little yellow spots now.
Okay.
What about in the pharynx table? I noticed a mention of hairy leukoplakia. That sounds a bit alarming.
It's actually not as scary as it sounds. It presents as whitish, raised plaques with a feathery or corrugated pattern, usually found on the sides of the tongue.
Okay.
It's caused by the Epstein-Barr virus and is often seen in people with HIV or AIDS. The key difference from candidiasis or thrush is that these plaques can't be scraped off.
So even something as seemingly simple as a white patch on the tongue can have vastly different causes and implications. It really highlights the importance of careful observation and a thorough patient history.
Absolutely. Every detail matters in our detective work.
Okay, onto the gums and teeth table. There's a condition called a pregnancy tumor. That sounds a bit ominous, doesn't it?
It's not actually a tumor in the true sense of the word.
Right.
It's more of a localized overgrowth of tissue known as a pyogenic granuloma that sometimes pops up during pregnancy.
Okay.
These growths are usually red or purplish, soft, painless, and bleed easily. The good news is that they usually regress after delivery.
That's a relief. So not all tumors are created equal. What about those worn-down teeth you often see in older adults? Is there a specific term for that?
That's called attrition, a natural process where the chewing surfaces of the teeth wear down over time, exposing the underlying dentin.
Interesting.
It's often accompanied by gum recession, giving that classic long-in-the-tooth appearance.
Yeah,
It's simply a sign of a life well chewed, you could say.
I love that. A lice well chewed.
Mhm.
Okay, one last highlight for the tables before we move on. Under the tongue, there's a condition called geographic tongue. What's the story there?
It's actually quite a fascinating condition. The tongue develops these smooth red patches that are devoid of papillae. These patches are interspersed with normal, rough areas, creating a pattern that resembles a map. And just like a map, the pattern changes over time. It's harmless, but can sometimes cause mild discomfort or sensitivity.
So, geographic tongue. Harmless, but potentially annoying.
Got it.
Got it. We've covered so much ground already, from anatomy and common complaints to a whole array of fascinating conditions. What's next on our oral health adventure?
Now that we've explored the diagnostic side of things, let's shift gears and talk about what you can do as nurses to promote good oral health and advocate for your patient's well-being.
That sounds like a perfect transition. Let's dive into the world of oral health promotion. All right, so we've explored the anatomy, played detective with those common complaints and fascinating conditions, and now we're ready to talk about promoting good oral health. It seems like, something everyone learns as a kid, but I have a feeling there's more to it than just brush twice a day.
You're absolutely right. There's a whole world of oral health promotion that goes beyond basic brushing and flossing. And as future nurses, you'll be in a prime position to educate your patients and advocate for better oral health practices.
So let's talk specifics. What are some key things nurses should be emphasizing when it comes to oral health?
Well, first and foremost, let's address those alarming statistics. Did you know that nearly 91% of adults aged 20 to 64 have untreated cavities, and almost half of adults over 30 have some form of periodontal disease?
Wow, those numbers are pretty shocking. It really highlights the need for prevention.
Exactly, and that's where you come in. By understanding the risk factors and emphasizing daily hygiene practices, you can make a real difference in your patients' lives. Simple things like using fluoride toothpaste, brushing twice a day, and flossing daily can significantly reduce the risk of both cavities and periodontal disease.
So it's all about disrupting that plaque buildup, right? That sticky film of bacteria that seems to love hanging out on our teeth.
Precisely. Plaque is the enemy when it comes to oral health. It's the main culprit behind both cavities and gum disease. And while brushing and flossing are essential, they can't reach every nook and cranny. That's why regular dental visits, at least annually, are so crucial.
Makes sense. It's like going in for a professional cleaning and getting those hard-to-reach spots.
Yeah.
What about older adults? Are there any specific recommendations for them?
Older adults often face unique challenges when it comes to oral health. Many experience dry mouth or xerostomia due to medications they're taking. This can significantly increase the risk of tooth decay and gum disease.
So it's not just age itself, but also the medications that can impact oral health. What can we do to help older adults who are struggling with dry mouth?
It's important to talk to your patients about the medications they're on and discuss potential side effects, including dry mouth. If a medication can't be changed, encourage them to drink plenty of water throughout the day and chew sugarless gum to stimulate saliva production.
Those are great practical tips. The textbook also mentioned the importance of addressing diet and tobacco use. Can you elaborate on that?
Absolutely. Diet plays a huge role in oral health. As with children, adults should limit sugary drinks and processed foods, which feed the bacteria that cause tooth decay. Instead, encourage a diet rich in fruits, vegetables, and whole grains. And of course, tobacco use is a major risk factor for oral cancer, so it's crucial to counsel patients about quitting.
It all comes back to those healthy lifestyle choices, doesn't it? But it's not just about physical health, right? Oral health can impact a person's mental and emotional well-being, too.
You're exactly right. Oral health can have a profound impact on self-esteem and social interactions. Imagine the confidence boost that comes with a healthy, bright smile. It can truly transform lives.
A healthy smile can light up a room. Speaking of serious conditions, the textbook touched on the concerning rise of oral and pharyngeal cancers. What should we know about these as nurses?
This is a topic that deserves a lot of attention. Oral and pharyngeal cancers are on the rise, and they can be very aggressive. Tobacco and alcohol use are major risk factors for cancers of the oral cavity, accounting for about 75% of cases. But what's particularly concerning is the increasing role of HPV infection in oropharyngeal cancers, which affect the tonsils, back of the throat, and base of the tongue.
HPV, the sexually transmitted infection.
Yes, that's right. It's estimated that HPV is now responsible for about 70% of oropharyngeal cancers. And what's even more worrisome is that many people with HPV don't even know they have it.
So how can we as nurses help in the fight against these cancers?
Early detection is key. We need to be vigilant in our examinations, looking for any suspicious lesions in the mouth and throat. And we need to educate our patients about the risk factors, including tobacco and alcohol use, as well as the importance of HPV vaccination.
It's a sobering reminder that even seemingly simple complaints like a sore throat or a white patch on the tongue can sometimes be signs of something much more serious. It really underscores the importance of staying informed and taking a thorough approach to patient care.
Couldn't agree more. As nurses, you have a unique opportunity to advocate for your patients' oral health and empower them to make healthy choices. It's all about connecting the dots, seeing the bigger picture, and realizing that a healthy mouth is truly a gateway to overall well-being.
This deep dive has been an incredible journey through the world of oral health. We've gained valuable insights into anatomy, common conditions, health promotion, and the importance of early detection.
And as you embark on your nursing careers, remember that every patient encounter is an opportunity to make a difference. By being informed, observant, and proactive, you can help your patients achieve and maintain a healthy, vibrant smile. A smile that reflects not just good oral health, but overall well-being.
And on that note, we wrap up our deep dive into oral health. We hope you've enjoyed exploring this fascinating world with us. Remember, a healthy mouth is a gateway to a healthier life. And as future nurses, you hold the key to unlocking that potential for your patients. Go out there and make us proud.